whenever any disease attacking on the human body, like right now we are talking about the corona. So when any virus attacking on the human body, it is passing from the different phases. So like any virus, if it is the virus, so any virus is attacking on the human body. So this virus is crossing the chakra view of the human body because human body is highly protected with the energy, with the channels. So this body is highly protected with the multiple layers. So this protection of the body is called the product called this protection of body is done by chi. So like whenever any pathogen is attacking the human body, it has to cross the 6 levels. So level 1, level 2, level 3, level 4, level 5 and level 6. So when any virus, any bacteria, any pathogen attacking on the human body, this is passing from the first layer, then it is going to the second deeper layer, then it is going for the third one and destroying every layer. And after fighting and winning, going to the fourth layer, then fifth layer, and finally on the sixth layer. So the divine has designed this body so beautifully, and our the most vital part are very deeply inside the body are protected. So these all layers are called the defensive system of the human body. Defensive system of human body. And if we are a good TCM master, if we are a good TCM healer or doctor, then just by seeing the symptoms, we can find out that virus has reached on the second level, third level, fourth level, fifth level, or it has reached to the last. Because body is showing some symptoms. So when this virus attack on the first level, body is showing some symptoms. Then this virus winning, proceeding further, attacking on the second level. Then body is showing some different symptoms. Going further and attacking on the third level. then we will see different symptoms. In the same way, this attacker going inside and inside, and body is creating the symptoms accordingly. So fourth, fifth, and sixth. So in that way, just by seeing the symptoms, we can find out, oh, attacker has just fighting on the level 1. So we can do the treatment of level 1 and we can expel the pathogen. We can throw out the pathogen from the level 1 only. And how can we recognize that pathogen has reached on the level 1? Just by seeing the symptoms in the body. Sign and symptoms. Sign and symptoms are very important thing. They are helping us to do proper diagnosis. So by seeing the sign and symptoms, we can find out that virus has reached on the first, second, third, fourth, fifth, or sixth level. And accordingly, we can make the protocol to fight with disease. So in the acupuncture, in the traditional acupuncture, these all layer has been explained very nicely. In the traditional acupuncture, it has been explained that whenever any pathogen attacking on the first level, this is called Tai Yang. Tai Yang. So Tai Yang is the outermost covering of our defense system. Outermost covering of defense system. The meaning of Tai Yang as per the acupuncture is a small intestine meridian and urinary bladder meridian. So the small intestine and urinary bladder meridian are standing on the first level. Here, if we see the Tai Yang, the meaning of Tai is maximum. And the meaning of Yang, who protect the body, who is in the outermost covering. Outermost covering. Because the nature of yin is living inside, living in the hidden side. This is the nature of yin. So as soon as this is either the virus of influenza or the virus of common cold, SARS virus, or what we are telling nowadays, coronavirus, COVID-19. Any virus is attacking. So first, this virus has fight with our outermost defense system, which is made by a small intestine and urinary bladder, or which is called Tai Yang. So this is the fighting going on. This is the coronavirus. This is the coronavirus. And this is Tai Yang. The fighting is going on. Fighting. Fighting is like a football match. The coronavirus want to win, and even Taiyang also want to win. So they are fighting with each other. If the immunity of person is strong, if this person is sporty, or this person is not much old, then our immunity will fight and the coronavirus will disappear just on the first level. It will create little bit symptoms, but for the person having poor immunity, suffering with a heart disease, suffering with the diabetes, or having lots of stress, just doing mental work, no physical exercises. So they are having more chances because immunity is low. So the coronavirus is very strong for these all person, and it will attack and it will win. Then it will be the winner. As soon as the coronavirus will win, now it is ready to enter in the second level. But when the fighting is going on between this coronavirus and defense system, Taiyang, so there will be some symptoms will appear in the human body. As per the TCM, what we are telling to this fight, what is the name of this fight? Because in the TCM, we are not telling that corona and Taiyang fight. In the TCM, we are giving some very beautiful name. So what we are telling in the TCM, in the TCM we tell it. So this is the corona attack. So in the TCM we are telling the attack of wind cold or the attack of wind heat, because these viruses are going through the wind. So either we will tell the attack of wind cold or the attack of wind heat. And this wind cold or wind heat attacking on the defense system. So during this attack, the fighting is going on, some symptoms appear in the body. What are the symptoms? Person will have mild fever. What is the meaning of fever? The meaning of fever is the body, the fight is going on inside the body. So this will be very mild fever. This will be not too high. Second, This person don't like wind. So if you put on the fan, the person want to go away. This person not liking cold. So even if you put on the air condition, this person will go away. And slightly tickling sensation in the throat, tickling sensation inside the throat. So these are the few symptoms. When we are learning the TCM, that time we are discussing these things in very detail. But right now, just I want to bring little focus. That I want to bring little focus that what we tell when this virus is attacking on our Taiyang, the outermost defense system. In the TCM, we are discussing in very detail that what is the meaning of wind cold attack and what is the meaning of wind heat attack and what is the treatment. And we are discussing them very scientifically. So, what treatment we have to do in this phase? So, we have to do the treatment of wind heat, or we can tell external wind heat or external wind cold. So, this is the first treatment we are doing for the patient having little symptoms, just mild symptoms like sore throat, feverish, the sign and symptoms of the kapha and cold. When we are suspecting, oh, something is wrong. So that time we are starting the treatment of external wind heat or the external wind cold. So right now, I will tell you what we can do in this condition. We are having one point in our human body. As soon as we see the mild symptom, we have to start the moxa on stomach 36 point, 15-minute and twice a day. The time, the 15-minute is time little more, but we have to do the 15-minute moxa on the stomach 36. The stomach 36 is the steroid point. Like when we are getting any problem, doctors giving steroid. But this is the natural steroid, which is not having any side effect. So we can start the moxa on stomach 36 twice a day. And as soon as we found, oh, something is wrong, we can also do the moxa on CV6 and CV12. These 2 points. So these treatment we have to do twice a day. So the moxa on the stomach 36 15 minutes twice a day. The moxa on the CV6 and CV12, 10 to 12 minutes twice a day. But we can't do moxa. We cannot do moxa if fever is there. So we can do the moxibation as soon as we see the sign. Or suppose someone in your home got the attack of corona. Then for prevention purpose, you can start the moxa on stomach 36, CV6 and CV12, but not for 1 or 2 minutes. It is very lesser. You have to do the 15-minute moxa on the stomach 36 and 10 to 12-minute moxa on these 2 points minimum twice a day. And if you do only this much, even you are living with the corona patient, but your immune system won't allow to attack this COVID-19 on your defense system. So if we see the location of stomach 36, so let's see. The stomach 36 is very famous point. The many person doing moxibation regularly, even they are having any problem or not. This point is improving the vitality. So we can see in this image. If we look at this image, so this is the knee joint. And in the knee, we can see this eye. We are having two eyes in the knee. The outer eye is called stomach 35. From this stomach 35, if we go 4 finger down, in the acupuncture, we are telling it 3 chun. So from this eye, if we go 3 chun down or 4 fingers down, then we are getting the location of the stomach 36. Let's see in the other image. Here we can see we are having, this is the knee joint, and this is the eye. From here we are going 4 finger down or 3 chin down. Here we are having 2 bones in the lower leg. This thicker bone is called tibia. Just on the border of tibia, we are having this stomach 36 point. So when you are doing the moxa, do not worry for the point, because moxa we are not doing on the single point. Moxa we are doing in this area, this much area. So there is no chance to do the wrong. This point is called steroid point because it is improving the immunity, vitality. Even someone is suffering with a knee pain, this point is very good for if you do the moxa. So we have to do the 15-minute moxa on this point twice a day. Generally in the clinic, we do 1 minute moxa for patient on this point regularly when suffering with some problem. But this is the question of COVID. Now the another question, another point that is called CV6 and CV4. So coming to the navel region, if in this image you see the navel region, this navel region is called CV8 or conceptual basal 8 point. From this CV8, if we go 2 fingers down, just 2 fingers down, then we are having the location of CV6 point. The CV6 point is also has been told the vitamin point. So it is increasing the vitamin, removing the weakness. This is also called energy point. This is also called the point who is increasing yang energy. So definitely, if someone is already having fever, so we avoid doing moxa. But for the purpose of prevention, we can start this point in advance. So this point will increase the power of your defensive system. So there is no any virus can attack. Let's see the location of another point, that is CV12. So from the navel region, if we go near about 6 finger up, then we are having location of CV12. The CV12 point has been considered as a very good point who prevent dampness or kapha formation. So if we do the moxibustion here for 10 minutes, it will not allow kapha formation, the formation of sputum. In the acupuncture, this point is tonifying our spleen. If spleen is becoming weaker, then we are forming the kapha or phlegm. So this will be the second point, which we have to do, stimulate with the help of moxibustion. So in this way, just 3 points, stomach 36 in the legs, CV6 and CV12. If we do the moxa here, then this is the excellent treatment for prevention, and this treatment is very common in China. They are very alert and they are saving themselves from the attack of this COVID-19. They are doing moxibustion, even needling on these points. So 2 needle will be on the abdomen and 2 needle in the legs, stomach 36 in the right side and stomach 36 in the left side. Just 4 points are enough for prevention purpose. So let's proceed now. So the first level of defense system is called Tai Yang. But there is a one other thought. So we will discuss that thought after some time. Otherwise, it may create confusion. Now suppose the virus or the bacteria is able to create fever. And this fever, then what to do? Because I told you, don't do moxibustion if fever is started. Then what we can do? Then we will start our treatment in the condition of fever. So what is the fever? So we can categorize in these two ways. Number one, prevention way, treatment for prevention. So I told you stomach 36, CV6 and CV12. Now, the attack of bind cold or bind heat now is there and started fever. Now what to do? Then our treatment will be expel bind cold or expel bind heat. Then question comes, how can we expel? Which point can be used? So in the TCM, it is mentioned, if you want to expel, then do the treatment of 4 gates. The meaning of 4 gate means large intestine 4 bilateral and liver 3 bilateral. These are the 4 points are called 4 gate. So the Li4 will be in the hands and liver 3 will be in the legs. In the acupuncture, the 4 gate has been explained like a plumber. What is the function of plumber? The function of plumber is removing the blockage so that all the flow will become normal. So our 4 gate is very effective if we want to expel something out very immediately. So as soon as we found there is something wrong and also some feverish sensation, so start the treatment with a 4 gate. So this will be the treatment number 1. So put the needle on the Li4 and liver 3 bilateral minimum for 30 to 40 minutes. Now the treatment number 2. Now we have to do the moxa on stomach 36 and CV8. The stomach 36 15-minute bilateral, 15-minute twice, and the CV8 minimum 10 to 12 minutes twice a day. We can do the moxa only when fever is not there. So like with the help of 4 gate. Now patient is comfortable, feeling that time no feverish sensation. He is comfortable. Then we can do, because in the early phase, patient is having only mild fever. He is not having very high fever. Once the very high fever starts, then moxa cannot be done at all. Because moxibustion, we are doing the stimulation of the point with the help of heat. So in this way, I told you 2 types of treatment. The treatment number 1 for the prevention purpose, stomach 36, CV6 and CV12, and the treatment number 2 in the early phase, when little symptoms starts. So I told you foregate means Li4 and liver 3, bilateral. Number 2, stomach 36 and CV8 moxa. So let's see the location. So start, first we'll see the location of foregate. So look at the location of Li4 point. The Li4 point is very famous point. It is also called painkiller point or analgesic point. So this is the thumb and this is the index finger. Now we are going down. This is the first metacarpal bone. And this one is the second metacarpal bone. Second metacarpal bone, MCB, metacarpal bone. In between first and second metacarpal bone, we are having one bigger muscle here. The name of this muscle is interosseous muscle. Interosseous muscle. On the tip of interosseous muscle, we are having the location of Li4. This is a very famous point in the acupuncture. And this is also called painkiller point. Let's see the location of Li4 in other image. So look at this image. Here you can see this is the first metacarpal bone and this is the second metacarpal bone. In between we are having Li4 point. So we have to needle Li4 and we can needle ½ inch or half chun. If you don't want to put the needle, then you can do sedation with the help of magnets, or you can do acupressure. Now, let's see the location of liver 3. The same location goes to the liver 3, but it is in the legs. Suppose if this is our leg, suppose this is not hand and this is our leg, then this is the thumb, this is the great toe, and this one is the first toe. And in between we are having liver 3. So let's go in the legs and we'll see the location of liver 3, which is exactly on the same location as per image. So look at this image. Here, this is the first toe, this is the second toe, and this is the first metatarsal, and this one is second metatarsal. In between, we are having the location of liver 3. So it is exactly same like Li4 in the arm. If you see in this image, then you can see here. The liver 3 is available in between first and second metatarsal bone. So when we insert the needle on the Li4 and liver 3 bilateral, it is the very excellent point to expel the pathogen. I have used this point for many patients suffering with the sports injury. So like someone driving the scooter, bike, and suddenly fall down, having pain, and coming to us, oh doctor, today I fell down, having pain in my knee, in my back, anywhere in the body. Just needle these 4 points. You will see the changes in 10 to 20 minutes. The person will feel very good in any types of injury because of fall down, because of sports, because of these all things. Right now, we are using these 4 points for expelling the pathogen out. So this is the treatment of our early phase. And after that, when patient is feeling little good, we are doing moxibustion on the stomach 36, which I already told you earlier. The stomach 36 is here, 4 finger down from the knee, and finally on the navel region. So when we are going on the abdomen, and look at the navel region here. So this is the location of CV8. The CV8 is just available on the navel region. The navel region is CV8 or navel point is a very great reservoir of energy. So we are doing the moxibustion all around, near about 2 fingers all around. So two fingers all around, near about 10 to 15 minutes, twice a day. So stomach 36 in the legs and CV8 here. These 2 points, combinations, very good. So in this way, this is the second treatment of early phase. So the first is prevention phase. Second is early phase. When patients showing some symptoms, so foregate, stomach 36, and CV8. As per the acupuncture, if we don't control the coronavirus in this condition, now this coronavirus will enter inside of the human body. So the first system, the first layer of Taiyang attacked by corona, this defense system is called Bichi. Bichi. So the Bichi is the outermost cover. Now, these all symptoms which we discussed happening just when the fighting is going on between this Bichi and the corona. The Bichi means outermost defense system. Now, this virus is entering inside to the second level. The virus been entering inside on the second level. Now the fight will be between corona and the second level defense system. Now fight will be more aggressive fight. Because of this fight is more aggressive, the immune system will send more cells to fight. So the lots of immune cells are increasing in our bloodstream. Lots of policemen or immune system are increasing in our bloodstream. And here, corona also improving the strength because the corona already crossed first level. Now he is in more power. Because coronavirus is made by RNA. And what is the symptoms like? Like you are going to some home. Now you're telling this is my home. And I am the commander of this home. So the coronavirus is RNA virus, which is entering in the cells and taking all the commands of that cells and doing the multiplications. So increasing the numbers. So the fight is going on now. The fight between immune system and corona. Because of these fights, lots of, this is called cytokine storm. Cytokine storm. This fight is called. Because immune cells secreting one chemical cytokine, and there are lots of immune cells secreting lots of cytokine, and it is increasing in the bloodstream. So there is a storm of the cytokine. Here on the other side, corona is in the form. The second defense system of the human body is called Yang Ming. Yang Ming. The Yang Ming means, as per the acupuncture, is large intestine and stomach. On the one hand, this coronavirus is there. Now this is more powerful because it is having feel of winner. And on the other side, we are having our second defense system, that is Yang Ming, made by LI and ST, large intestine and stomach. So the fight is going on. Fight. Because of this fight, lots of chemicals coming in the bloodstream. This is something like the fight going between the India and Pakistan. Either whoever, anyone who, there is no matter who is winning. India is winning or Pakistan is winning, but there are lots of pollution all around because of the bomb blastings and all. Lots of pollution all around. In the same way, when fighting is going on between the coronavirus and our Yang Ming, large intestine and the stomach, then lots of cytokines secreted in the bloodstream and lots of inflammation. Inflammation is happening. What is the inflammation? The meaning of inflammation, like in the war, when the two persons are fighting, lots of blood all around. In the same way, when there is a fighting is going on. So we can see lots of redness, swelling, even pain, edema means dampness. Even if you see the CT scan now, in the CT scan, when you see the CT scan of lung, in the lungs, we will see, especially in the first in the lower lobe, multiple spots in the lower lobe of lungs. Slowly, if we don't able to fight, then this will convert in the lower pneumonia. So the lower lobe of the liver will suffer with the pneumonia. But right now, redness, swelling, dampness is there. Lots of inflammation is there. And person is having shortness of breath. Because of that, the vital capacity of lung is decreasing. So this creates shortness of breath. Fight is on. Here immune cells is making more and more immune cells. Here corona is also in the full form doing the multiplications, increasing the numbers. Now again, if our immunity is good, so here also, if our immune system is strong, then from this stage also, person may go in normal condition. But suppose if immune system is not good, then again, who will win? Corona. Corona will be winner. So as per the acupuncture, the first level of defense is made by Tai Yang, or we are telling the attack on the outermost covering of body, which is called Vichy. Now, second level defense system. So this was the first level. Now the second level defense system is made by Yang Ming. And we are telling it, first we are telling Vichy, and second we are telling Qi level. Qi level, first is Vichy level. The Vichy means the outermost covering who is in between the skin and muscles just below the skin. But now second level is called Qi level. Now virus is attacking on our Qi, on our energy. So in this condition, person will start getting weakness. And I told you shortness of breath, inflammation. Lots of spots, multifocal spots on the lungs if you see the CT scan. If we don't treat, then This condition will turn into third one now. Virus will attack on third level. The third level is made by Xiao Yang. The meaning of Xiao Yang means like a, this is the junction of exterior and interior. Because first virus attacked on the Taiyang, then reached to the Yangming, then reaching to the Xiao Yang. Now after Xiao Yang, after binning the Xiao Yang, this will enter in yin part, yin. Because Taiyang is a yang, outermost covering. Then Yang Ming is also yang, the second level. Then Xiao Yang is also yang, the third level. But virus is so powerful, keep on entering, keep on entering. Now Xiao Yang will, as soon as the virus will defeat the Xiao Yang, it will enter in the yin. In the yin, first it will attack the Tai Yin, which is lungs and spleen. As soon as it attacks the Tai Yin, means now this virus has entered in the very deeper level. Now patient will suffer with multiple complications like pneumonia, or we tell it lower pneumonia, because most of the time the lower lobes of the lung are affected. Shortness of breath. The kapha is there, but person is unable to take it out, then suffer with the dry cough. Kapha is there in the lungs, but the person is unable to expel out all the kapha. So after binning the Tai Yin, the virus will enter in the deeper level that is called Xiao Yin. The meaning of Xiao Yin is heart and kidney. Then person will suffer with more breathlessness, because heart is connected with exertional dyspnea, means as soon as you do little work and you will get breathing difficulty. So we will tell breathlessness with exertion. And also because of the kidney, person will be having pain in multiple bones. Even slowly and slowly he will suffer with a more breathlessness, because kidney is responsible for breathe in, and person will suffer with the more symptoms related with the heart and kidney. As for the acupuncture, the meaning of heart is also blood and blood circulation. So the inside the capillaries, inside the capillaries. There will be some blockages will be created in this stage. Now, if this viruses keep on attacking and the person will be reach on the last stage that is called zoin, pericardium and liver. Now pericardium and liver is affected, which is the deepermost seat of the human body. So on the third stage, as soon as virus is attacking on Shao Yang, it will enter in yin and one by one attacking Tai Yin, Shao Yin, and Zuin. Tai Yin means lungs and spleen, Shao Yin means heart and kidney, and Zuin means pericardium and liver. And here, the meaning of Shao Yang means triple wormer and gallbladder. So this is the sequence of all the 6 phases. So when we talk about the 6 phases, the outermost layer is called Tai Yang, Si plus UV. The second layer is called Yang Ming, large intestine plus stomach. The third layer is called Shao Yang, triple Bormer plus gallbladder. After that, we are moving to the Yin. The fourth layer is called Tai Yin, means lung and spleen. The fifth layer is called Shao Yin, means heart and kidney. And finally, the last layer, the deepermost layer of the human body, is called Zuin, pericardium and liver. If any attacker has reached to the last stage, then it creates lots of complications. Hospitalizations is required. In the last phase, person is suffering with insomnia and multiple disorders connected with the liver, because liver is the place where our etheric soul resides. So liver is the place of soul. Person is getting disturbed very deeply if this virus is reaching to the final goal. So in these conditions, as per the acupuncture, the first level is made by Tai Yang, as I told, or we are telling the beachy outermost. The second level is made by Yang Ming, or we are telling it Qi. The first is Tai Yang, means Si plus UV. The second is Yang means Li plus St. Now, as soon as this is reaching to the third level, Shao Yang means triple Bormer and gallbladder. This is the junction, and we tell nutritive level. As soon as any virus entering this nutritive level, then it's very easy to go in all the stages like Tai Yin, Shao Yin, and Zui. So these all are coming in our nutritive level. Now suppose if we talk about the attack of corona and and the treatment. So first I told you prevention phase, stomach 36, CV6, CV12, moxa. Then second I told you the early phase. The meaning of early phase when some symptoms starting. And I told you do the 4 gate means Li4 and liver 3 bilateral as well as stomach 36 and CV8 moxa. Now third condition is called pneumonia phase. In this phase, we required lots of different type of treatment. And the fourth and last phase is called a recovery phase. When the virus is finished, now person is recovered, either with the hospitalization or maybe because of some home remedy. There may be lots of things. But the patient is suffering with lots of problem in this recovery phase also, like dry cough. Even after recovering, he is suffering with lots of problems, like a dry cough. And weakness. And we tell it post-COVID myalgia. Means COVID is finished now, but the muscle pain is still there. Lots of muscle pain. Person is having the great weakness. The post-COVID myalgia. And the many person are feeling little feverish for 15 days, 10 days, and slowly they are recovering. But there's a very common problem that is called post-COVID myalgia. Means now COVID has gone, but still person is feeling lots of weakness. Still having some dry cough, feverish. Then what to do in this condition? Then we are, as per the TCM, we are doing the treatment of governing vessel 14. This is the very good point for the fever, for the feverish, and for any attack, even after completing the attack. We are doing the treatment on the urinary bladder 17 and urinary bladder 30. The urinary bladder 17 is the point of bladder. The urinary bladder 13 is the backsu point of lungs. And we are doing treatment of the stomach 36 and lung 6. The stomach 36 point is very good, I told you already. And lung 6 is the G cleft point. of lung. So just by 1, 2, 3, 4, 5, just by stimulating these 5 points, we can work on the recovery condition. Recovery phase is the fourth phase of COVID. The first phase is prevention, like just for prevention. Second phase, we can tell early phase. Third is a pneumonia, influenza, attack, suffering, and fourth is a recovery. So this is the treatment of recovery phase. If you do this treatment, then you can recover the patient very fast. Now finally, why person feel weakness? Why person feel weakness after COVID-19? What is the reason behind the weakness? The reason is this: because after the illness, the water or fluid orbital yin of body get consumed. So like we are having more than 70% water in our body, but after the recovery, we are having very lesser water in our body. Stomach is very dry. Lung is very dry. In the acupuncture, we tell it stomach yin deficiency, lung yin deficiency, lung qi deficiency. So we have to do the treatment of these things to recover energy. Again, we have to increase the level of fluid again. So how can we do that? What are the points? So what are the point of stomach yin deficiency? What are the point of lung yin deficiency? What are the point of lung qi deficiency? If we apply them, then we can work immediately. So after the COVID, we have to do the treatment of these three. So this is the completion. Now I am giving 2-minute break. If you have any questions, then you can ask me. Only 2 minutes. Okay. So any questions? You can type here if you have any questions. So see, what I told you, this treatment is going on in the China, because the what I if we discuss about the corona in detail, it will take at least 1 week. It is too vast, because today I have think lots of like there are multiple phases of the attacks. Then I thought it's not possible to cover these all parts. So I thought, so let's do the summary. So the question is this: whether needle and seeds are equally effective. So the answer is this: needle is more effective. But seeds and magnets it is also effective, but we can give them second number. But if we put the magnet or if we put the seeds for little longer duration, then we can achieve the same results. But needle will do very good work in 30 to 40 minutes. See, after the attack of COVID-19, even person are getting the re-attack after 3 to 4 months because the previously many person was telling once you got the attack of corona, then there is no chance because you will develop the antibodies. But some person has got attack thrice, so it's very strange. Research is going on, so you can do the moxibustion for the prevention purpose, definitely. See, the person who recovered from the hospitalization but is still having memory issue because the COVID-19 attacked on the Shaoyin heart and kidney. Heart is having memory. You know, I have read some story. One lady did heart transplant. The lady was near about 50 or 52 and took the heart of 16 years young person. So as soon as he took the heart, she got transplant. She was having desire to drink, wear, dance, and all like the 16 years old guy. So the thing is this: this is the research that heart is retaining memory. Heart is connected with the brain, and kidney is also very deeply connected to the brain. So you have to do the treatment of heart yin deficiency if person is suffering with a memory loss. The COVID, as soon as the COVID will reach on the third level, Shaoyang, means triple hormone and gallbladder, the joint pain will start. And even after he recovered from the COVID, joint pain still be there. So how to treat this person? Do the moxibustion prevention treatment. Do the moxibustion prevention treatment. Do the four-gate treatment. And now then you have to do the treatment of triple hormone and gallbladder liver means third level. So still joint pain is there. Then you have to balance the third defense level. Yes, 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 yes. In the TCM, it is mentioned you can work on any level. As soon as you know the virus has reached to fourth level, so we are having the treatment of fourth level. We are having the treatment of fifth level. We are having the treatment of first, second, third, fourth, fifth, and sixth level. But very lengthy description. Means if it will, then we have to discuss a complete lung chapter. It is very lengthy description. See, it's right now Why it is not possible to tell the treatment of each level? Because in each and every level there are subdivisions. It will take longer time. What one person narrated that he has teething, hollowness while touching upper and lower row of teeth. This is because if someone is having any symptoms, someone having any symptoms, so we have to find out that the person is having the symptoms of which level. Okay, so I will tell you one very simple treatment for every level. Just to collect the symptoms after getting recovery. Because if someone is suffering with the corona, that time you should know how to do the treatment of that toxic phase that is called toxic epidemic attack. But right now I'm not telling that. I'm telling the person is recovered but is still having some problem like joint pain, hollowness, and this and that. So collect all the symptoms, then find out which meridian is more affected, like heart and kidney, or liver pericardium, or large intestine and stomach, or whatever, or lung and spleen. And just put the point third and fifth number, means stream point and Hisi point. Because every meridian, like lung meridian, I'm talking about the 5 transporting points. 5 transporting points. If someone is having symptoms of lung, so the third number point is lung 9 and the fifth number point is lung 5. So in that way, if we talk about the heart, the third number point is heart 7 and the fifth number point is heart 3. If you are not able to understand what I am telling, it means you don't know 5 transporting point, because I am talking about the 5 transporting point. What is the meaning of 5 transporting point? In every meridian we are having 5 points, which is called 5 transporting point. You have to take third number and fifth number point. With the help of third and fifth number point, we can balance complete meridian, any meridian. So this is the simple treatment. Otherwise, we have to learn the COVID in very detail, because if we go in the detail, I need 1 week. Every day, 90 minutes, 1 week. The triple, if someone is suffering with a multiple joint pain, then do the treatment triple warmer 5 and gallbladder 41. The triple warmer 5 and gallbladder 41 for the multiple joint pain. So first we have to insert gallbladder 41. Then we have to insert the triple warmer 5. So we can put the bilateral, because these are the points belong to EOB, extraordinary vessels. These are extraordinary points having the capability to balance complete meridian. If you want, you can put in the fingers in the sujok. star magnet on the triple bottom on the gallbladder 41 and triple bottom 5 bilateral. So with the help of this, you can work on the multiple joint pain. If we go deeper in the EOB, then it is told for the female, for the female, gallbladder 41 will be on the right side. Right side. And for the male, gallbladder 41 will be on the left side. And the triple bottom 5 will be always on the opposite side. So just remember this thing. With the help of only these 2 points, we can work on the multiple joint pain. If someone is getting the fever like 100 degree, so this is the Taiyang level, early phase, like 100 degree Fahrenheit or 99 degree Fahrenheit. So the first level or early phase, we will tell mild fever because the normal is 98.6 degree Fahrenheit. That is the normal value. But now person is getting 9900. It is mild fever. So this is the attack on Taiyang, first page. So we have to start the treatment from 4 gate. Li4, liver 3, bilateral. Then we can do stomach 36 and moxa on the navel. I told the triple bomb of 5 and gallbladder 41 are EOB point, extraordinary vessels point. So these single point having great capability, very, very great capability. So with the help of these single point, we can work on the multiple joint pain. So for the female, put gallbladder 41 on the right side. Whether you put the magnet or you put the needle, or for the male, gallbladder 41 will be on the left side. Just take care of the patient if suffering with low blood pressure. Just take care of the patient. If having low blood pressure, then do not put for longer time either magnet or needle. Even 5 minutes is enough. 5 minutes for the low BP patient. For the high BP patient, no problem. Even you can put for 30 minutes, 40 minutes. For the low BP patient, what is the safe thing for the low BP patient? For the low BP patient, the safer thing is this: First you put triple warmer 5, then gallbladder 41. I don't know whether you are understanding or not, but I am telling once again. If patient is suffering with a low BP, then first you put triple warmer 5, then gallbladder 41. And these points we are always putting in the cross. Cross means if triple warmer 5 is in the right hand, then gallbladder 41 will be in the left feet, left side. And remember one thing, first point will be always in the right side of female. Because female are always right. Am I right? So female are always right. So first the point will of EOB for female will be on the right side. Because whatever point we are putting first, that is main point. Whatever we are putting second, that is the couple point or secondary point. Got it? Now you don't worry for the low BP patient, because with the help of this point, even you can treat the multiple joint pain, and the low BP patient will get good energies.